Okay.
It's technical talk.
Go ahead.
Good evening, everyone. Thank you all for joining the county's virtual press conference today. On the line, we have El Paso County Judge Ricardo A. Samaniego, City County Local Health Authority Dr. Hector Ocaranza, CEO of UMC Jacob Cintron, who will also be joining us, and we also have Deputy Chief Jorge Rodriguez with the Office of Emergency Management. Getting us started today will be County Judge Ricardo Samaniego.
Well, good evening. As it seems like very short on Friday, we had a press conference, and I know it's extremely difficult when we have so much information coming at you, but things have moved so fast over the weekend that I felt that it would be very necessary to have this discussion with you and talk about the new provisions that we'll be issuing out today. And so you know that one of the reasons, and I want to reiterate, the reasons for the new order have to do with that we're at a crisis stage. This week, the county is in the process of executing agreements for additional morgue space. We are the subject of national news noting that funeral homes in El Paso are preparing for a surge. We have had 160% increase in our positivity rate since October 1st. We have seen an increase over 300% in hospitalizations. Currently, our hospitals are stretched to capacity. As of October 24th, 2020, all area hospitals have reached capacity. All intensive care units in El Paso hospitals are at 100% capacity. Active cases have exceeded hospital capacity, and the Texas Department of Emergency Management has been deployed to convert the convention center into an auxiliary hospital for up to 100 beds. So as you can see, it's the kind of information that that should all of us as community members take to heart. One of the things I want to emphasize, and I'm not sure I did that sufficiently, has to do with voting. And I want to make sure that no one feels that there's any change in the voting, our support. Voting is an essential function, and it is a responsibility of each registered voter to vote in this election. Important for public to understand that voting is safe, and our county elective department has taken steps to ensure the safety and health of El Paso voters. Please continue to exercise your right to vote. So when we talk about the county using more resources at home and more employees, it does not in any way impact the services of either the county or the election department. So I want to make sure that that is very clear to our community. Stay home provisions would be Section 1 under our order. All citizens should stay at home. Citizens are required to stay home unless they are assessing essential services. For those citizens who are assessing essential services, only one person per family member is allowed. This is one of those restrictions that we had carefully had discussed, but now it's really, we're asking for you to make sure that you find every opportunity to utilize one member of the household when you go out to essential businesses. This one, the curfew, I think is the one that should alert all of us as to the importance of what is taking place. And so a curfew is imposed for all citizens between the hours of 10 p.m. and 5 a.m. under Section 3 of my order. The purpose of the curfew is to limit mobility in the community. It is, in fact, the recommendation from public health and from our medical advisors and professionals that minimizing the mobility will, in fact, impact the flattening of the curve. So the less mobility, the less possibility, when you have that many cases that are active at this point in time, you will be addressing that the virus does not continue as much as we've seen it in the last 3 or 4 days. The curfew is an option to limit the economic consequences on local businesses by allowing the stores to stay open. We carefully thought about the economic impact if we were to impose a full stay-at-home, work-safe order that, like we did at the beginning of this process. And we know the impact it would have for you not to be able to go to work. So we're going to do everything possible to continue moving towards the balancing of the economy and making sure that we adhere to public health and everything that is required for us to continue our battle against this very insidious virus. Curfew is not applicable for people who are traveling for work or essential services. So at the time after 10, there's still essential services that are taking place, and obviously we'll take that much into consideration. Enforcement will be a vital component, but I want to make sure that everyone understands that it is one of the elements. As you can see, there's 2 situations that we're active on. One of them is to focus on the virus itself, which is the testing, contact tracing, and so forth. And the other part of it is what do we do to eliminate the increase of the positive cases in our community. So when you look at the 2, they need to come together. It's very important that you understand that enforcement at this time is going to be very necessary. It's something that we're hesitant about because of our tremendous respect for law enforcement, a tremendous respect for our community, but we find ourselves at this time to be in a situation where this has to take precedence over a lot of things that have taken place. We focused on education, we focused on compliance, but if you can see, the numbers have not gone down. I had a discussion earlier yesterday with the governor's office about certain situations of moving in this direction. Then this afternoon, a couple of hours ago, I did have a conversation with Governor Abbott, and the idea of law enforcement and enforcement of the protocols and the things, the orders, seemed he was very, very concerned about the level of enforcement that was taking place. And that, I can tell you, is information that he gets from the Alcohol and Tobacco Commission, where they find that there's not compliance. He probably took that from the number of citations that we have compared to other areas. I can tell you that law enforcement has been very engaged, both the police department and the sheriff's department, but it was his opinion, and I'm supporting his opinion, that we do need to take further steps with respect to enforcement. I can tell you that after Friday, we received a tremendous amount of support from our community that we are in fact going in the right direction, and that we do have to do something about the numbers that we've been seeing. So any peace officer can enforce $250 fine for face mask coverings or not wearing your face masks, $500 fine for any other violations of the order. And like I said, the governor has expressed that we are not enforcing to the level that we should be. And we will be developing a task force to help with the enforcement. We will be looking at county employees and other employees to see how we can manage a task force to help us with this. Enforcement is always delicate, but it is something that we need to move forward. We will be monitoring every situation, and we're hoping that the community does respond. I would like to say that we have reached out to Congresswoman Escobar, to the entire delegation, to Senator Rodriguez, and we will be reaching out further to the rural mayors here in El Paso. Tomorrow I will be having a regional meeting with the mayor of Las Cruces, the mayor or the representative of Juarez, County Judge Neely from Hudspeth County, Mauricio Ibarra, our consul from Mexican Consulate, will be there as well, and Mayor Margo will be there on my decision to have a strategic approach to make sure that we're looking at this from a regional perspective. I do believe that the dynamics of our relationships with both Doña Ana and Juarez and ourselves, we have to look at and make sure that we're doing the best that we can to help each other. We're not alone on this situation, and it's something that we believe, and I strongly believe, will be a regional approach that will help us. There are a lot of other elements, and most of all, as I've said in the prior conference, we really need to engage our community to work with us. I also want to remind you that we're in about a 90-10 rule. 90% of our community is responding, so I hope there's never any insinuation that the majority of our community is not responding accordingly and properly and civically minded to help us with these orders. But the fact that 10% do create some issues, unfortunately, we find ourselves in this situation. We will be monitoring and determining whether we need to have further steps, but I'm hoping, and I've always had tremendous amount of faith, that our community will respond accordingly. So thank you very much. We really appreciate that you join us in this effort. I know the kinds of passion that we have. I know we're still going through a healing situation because of August 3rd, but we really need to be El Paso strong and show our passion and our commitment to flattening the curve. We will now have our guests address their particular area, their respective areas, so that you can get a full understanding of what is taking place in our community as we speak. Thank you and good evening. Nicole?
Thank you. Now we'll be hearing from City County Local Health Authority, Dr. Hector Ocaranta.
Good afternoon, everybody. As we continue to see a surge in cases of COVID-19 in our community and those devastating effects that the virus has had on all our most vulnerable members of our community, in which they have required higher level of care in going to the hospital, and many of them require an intensive care unit, it is imperative that everybody avoids the opportunity to have the virus spread even further within our family and within our community. We know, and we have mentioned before, that the virus spreads very easily from person to person, so we need to encourage everybody to stay home and avoid those opportunities for the virus to spread even further. We need the cooperation of everybody. We really need to continue being united as a community, in which we're going to continue helping each other and helping our community at the same time. We appreciate all the support that everybody has done in making an effort to stop the spread of the virus throughout the community, and we'll continue to work tirelessly to address the needs of the community. And with that, thank you very much, Nicole.
Thank you, Doctor. And also joining us today is Jacob Cintron, our CEO of the University Medical Center. Mr. Cintron?
Go ahead and go to Chief Rodriguez, please, Nicole.
Okay, next we have our City County Deputy Chief Jorge Rodriguez from the Office of Emergency Management.
Hi, good afternoon. Just some quick updates on the testing assets that have been brought in over this last week. And due to the demand in testing that we've seen over the last 2 to 3 weeks, we opened 3 new additional sites, one with in partnership with the University of Texas at El Paso, which has been running some very high numbers over the last several days. It's been very successful. We also opened a new site working with the Texas military at the Eastside Sports Complex. And we also partnered with Region 19 to set up an additional 3rd site with the Texas military there at the location. The UTEP site is a mega site. It can do 1,000 tests per day. The Eastside Sports Complex and the Region 19 locations are they have a capacity of 500. So over this last week, we were able to increase the total capacity to 2,000 more tests per day. We averaged a little over 67,000 tests per day this last week. So continue to go and take advantage of the resources. We also, in partnership with the county, with the support of the county judge and Ms. Betsy Keller, we'll be opening up another mega site at Escarte Park this coming week, and that'll again provide some additional resources there. In regards to the hospitals, and Mr. Cintron will touch this a little bit more, but we are working very closely with the Texas Department of Emergency Management on bringing in those additional resources, working closely with Border Act with the coordination of additional staff. Over 800 medical personnel have been assigned to El Paso to help in staffing additional beds within all the hospitals and additional resources to help expand capacity within the hospitals, within their walls, as you'll see over the coming week. And also, as the judge mentioned, the alternate care site, we're making preparations for that to help with hospital overflow. We're working very closely with the state to get that in operation. Other than that, those are the updates I have. Thank you all very much.
Thank you, Chief. Judge, we can now take some calls from our media partners who are on the line.
Thank you.
First one that we have is the number ending in 6571. You can please state your name and your organization.
Hi, this is Chris Babcock with the El Paso Herald Post. Judge, was just wondering about the timing of this. You mentioned that it was due to the increase of cases and the new information that we had. When does this order go into effect?
This one will go in effect tonight, immediately, and it'll coincide with the one on Friday, but we're incorporating. It'll be a 2-week time period, so that we can have enough time to address it, but also enough time to see if there's any reason to adjust and not go further stricter, or that we have to take some actions. I did mention that as Thanksgiving is coming up, and we've got Halloween coming up as well, we really need to understand that the numbers cannot continue, and we've always had peaks when we have holidays. My goal is that we're able to understand very clearly before Thanksgiving as to how we're going to address and what limitations will be applied during the Thanksgiving holidays. And so this next 2 weeks is extremely important for our community to show that we're able to relax on some of them, on obviously not all of them, but relax on some of them so that we can have a different situation going into Thanksgiving. Halloween, we're not allowing trick-or-treating. It goes really against the order of any kind of activity during that will create any congregation at all. So the order is very explicit that Halloween activities will not be allowed.
Okay, the next.
Very well. Thank you, Judge.
Next person we have.
Thank you, sir.
Is ending in 5612.
Hi, this is Angela Cochergo, TV Public Radio, and I am asking who is in charge of enforcing the orders, whether it be this one or the gathering of groups.
Amanda.
Who for the
I'm sorry, was there, go ahead, please repeat your question. There was some interruption in the middle of your question.
Okay, let me start over. Angela Kocherga, KTEP Public Radio, trying to find out who for the county is in charge of enforcing the orders, the emergency orders, this one that you're imposing and past ones about gatherings. And have any waivers been issued for gatherings, and are those still allowed right now?
I'll start with no, there's no waivers. They're allowed. Both the city and the county have determined no waivers. Any peace officer is able to enforce the order. We're be able to give a fine for the orders. So any peace officer, would be any one of the, obviously the sheriffs and the police department will be able to enforce, and obviously the constables, which have been extremely close to the situation, will also be able to enforce the order.
Okay, next person.
Thank you.
Next person that we have is ends in 1760.
Hi, Dave Burge, ABC 7. What is the status of the request to use Beaumont Army Medical Center as for non-COVID patients? And also, who has the authority to shut down businesses that are in non-compliance?
Well, the order itself can enforce businesses not in compliance, because the order is actually becomes a law. And if they violate the law, they're able to shut down a business because of non-compliance. And with respect to Beaumont, I spoke to Representative Blanco earlier today, and they feel that they're getting closer to that decision. The only edit that I'd like to make is that I'm not sure that we would like to also petition that we have COVID patients be able to be serviced, because we are struggling with space. And so I would like to add that, but if we get it just for non-COVID, I'd be pretty excited. It really is one of the better strategies, because they are equipped already to handle over 100, from 70 to 100 patients. So that in itself would be very favorable to us if that happens.
Do you know when a decision will be made on that? And then also, what about the impact to high school sports?
Well, the order, we're actually recommending that for the next 2 weeks, that sports would be, terminated or not allowed for the next 2 weeks as part of our provision to help us with this mobility for the next 2 weeks. That one is highly encouraged on our behalf from the county, or as a county judge, it's highly encouraged. And as you can see, anything that stops the mobility for a while will help us regain our footing with the hospitals, whether it's healthcare workers, whether it's more beds. And so by slowing down, it allows us to then make, not have to be in such a crisis mode. And so that's one that we're really encouraging. We ourselves at the county have closed Escarate, closed the golf course. So I hope that we're role models in showing that we need to move forward with respect to, stopping the mobility as much as that we can. I know that there's already businesses, I'm really proud there's businesses that already know that they're not handling the situation. It could be a little overwhelming for them. They still have the right to do 50%, but they're making the decision not to, or either go to 25% or do some other things that are not necessary, but are extremely, respectful towards the order.
Any time frame on Beaumont decision?
Oh my goodness, it's day to day. Trying to wait for that. I know that Jacob Centron, our CEO from the UMC, is very encouraged as one of the possibilities, as are the other private hospitals. What's very important is that at this time, one of the critical points is that the non-COVID patients are beginning to suffer the consequences. If you're in an emergency and so forth, and there's no space, then it's going to interrupt our interventions with non-COVID, and that's why it becomes a critical situation at this point in time. Not only the COVID patients, but also the non-COVID patients having to deal with lack of space. I don't know if Jacob Centron was able to make the call, Nicole?
Yes, sir. He's on the line now.
Okay, Jacob, we sort of touched on a lot of different things, but if you could focus on some of the critical situations that you're finding in the hospitals, and also the type of resources that we've received from the state, and including the 10 situations at both the our county hospital as well as the private hospitals. Go ahead, Jacob.
I think he's having some technical issues, Judge.
Issues. Chief Rodriguez, would you be able to discuss some of the support services directly to the hospitals, like the tents and so forth? Would you be able to address that, Chief Rodriguez?
Yes, sir.
Okay,
so,
thank you.
Working with ENTF there through the state of Texas, they rolled quite a bit of resources this week, and they're right now with UMC specifically for the county hospital. They're providing some additional tents that are going to be used for overflow within the hospital. We also have additional resources coming in from the state that are going to be providing the same level of structures to be able to provide additional capacity for the hospital. So that will be occurring this week. Some of them are already on the ground, and plans for setup are beginning within the next by tomorrow and the following days. So they're primarily just to again provide additional capacity within the hospital walls, and then with that they're able to expand their beds, and of course every bed that is expanded within the hospital requires staffing. So they received quite a bit of staffing. Over 800 medical personnel have been assigned to the hospitals through the three major hospital systems, and they're coordinating very well between each other, and we're in constant communication with them to ensure that we're getting the resources where they're needed.
Chief Rodriguez, that also includes the support you'll need for the Civic Center, right, or the Convention Center. Am I correct?
Correct, sir. And that's going to be separate. The alternate care site at the Convention Center, that is going to be provided through a state contractor that is going to bring in additional staff, and that won't be impacting any of the staff that's already been committed for the hospitals that are currently being supplied now.
Thank you.
Judge, I'm on the line now. I don't know if you can hear me.
Yes, we can. Jacob, we're about closing down, but Chief Rodriguez did comment on this. If there's any additional comments, would you please go ahead? Thank you.
Just briefly, simply that, our COVID patients hospitalized have been the highest since the pandemic started. Hospitalizations have doubled since 10 days ago. I do know that the alternate care site at the Civic Center will be able to handle 50 patient rooms with be able to receive all kinds of patients that are COVID positive, including high flow O2 patients, which is very important for us. All systems continue to grow in terms of beds, and they're relying on their other resources. For example, hospitals of Providence and Las Palmas del Sol are getting resources from their other sister hospitals. We continue to grow and receive help with additional staff and beds from El Paso Children's Hospitals. And of course, through Border Rack and Wanda Helgeson have been very successful in getting us a lot of manpower to be able to assist us to continue to handle the influx of patients.
Thank you very much, Jacob. Very informative. Miguel, do we have any other questions on the line?
We have two more media outlets. The next one that we have ends with 6802.
CBS 4. My question is, how will you determine the people who will be honest about where they're going in regards to the citations? Will they be stopped on the road? Would you be able to elaborate on that?
Well, I had a discussion with another county judge that has the curfew. There's not many that do have it, but they had spiked, and they are enforcing it by stopping individuals that are out by 10, and doing a courtesy of asking them if they're essential workers or they're headed to essential business, and if not, directing them not to be out after 10 o'clock. If that is not adhered to, that enforcement or there is any, they will be notified as to that they have been stopped. So other peace officers will know that, and if that person is stopped again, then obviously then we would enforce the fine. So we encourage obviously not to be out at 10. But I also don't want anybody to be concerned if they're headed in any way that they're going to essential businesses that we've described in the order. So really recommend everyone to understand the order as much as possible. But this is not, something that we want to do, but we have to do. But it's not going to be an aggressive, situation on individuals after 10 if they are encouraged to adhere to it. And that was from one of the Judge Vera from Starr County, focused a lot on that, and that the community did respond immediately, and that there was not a lot of reasons as to become more aggressive in any way. So I know El Paso. I know how we could be very positive. People do respond to that, and so I'm hoping that the same situation happens. That we do not have to take the next step or have to do the enforcement as the ultimate. We prefer to get our community engaged properly first, and then we would have to take the next step. As I said, I've discussed things with Sheriff Wiles. He's very supportive. Sheriff Wiles has reached out to Chief Greg Allen, so they're both aware, and I've reached out to both Constables Ugarte and Constable Garcia, and to let them know our situation. And so we're working very well, and they've always been great at compliance and enforcement in the most positive manner.
The last media outlet that we have ends in 1693. Go ahead.
Hi, this is Brianna Chavez with ABC7. Judge Samaniego, I spoke to Ricardo yesterday. He said that you and him both spoke to the governor last night. If, once these 2 weeks pass and we go through this curfew and everything, could we foresee a shutdown happening anytime soon in our area? Hopefully nobody answered that question or asked that question. I just jumped on the line kind of late. So.
Well, no problem, Dana. Always a pleasure. But just to be clear, the mayor and I spoke to the chief of staff yesterday. And discuss things with him about the possibility of going to a stay-at-home order. But we agreed that it would be harsh on the income of our constituents. And then I had a separate discussion with the governor this afternoon, primarily on enforcement. And I want to be clear that I felt that we needed more discussion on other elements, and he was more focused that our community and our law enforcement were not responding accordingly, which I do not agree. I think we've done everything possible to do the right things. The Alcoholic and Beverage, Tobacco and Beverage Commission does need to do their work as well. And so I asked for additional support because those are state enforcement. And so I made him as well accountable for the fact that we need his support in enforcement. We've been more successful at that level because that is part of their routine checks going into establishments to make sure that they are following every order, whether it's our order or the provisions by the ABC, Alcoholic and Tobacco and Beverage Commission. So we did ask for, and I did get a call or a text from his chief of staff saying that they would send additional support from them immediately.
Okay, Judge, that's it for the callers that, we just had one join. 1 second. Caller ending in 7583.
Hi, this is Andy Morgan with KTSM 9 News. Judge, I know you had mentioned about athletics and sports, so just to kind of clarify, I know the school districts make their own decisions as far as competing and that sort of stuff, as well as UTEP. Does that mean that you are recommending both UTEP and the school districts to halt competition for the next 2 weeks?
No, well, Andy, thank you. Always a pleasure as well. But no, we're really looking at, we haven't been able to look at professional and college. That's totally different. Because of our relationship, and especially Dr. Carranza's relationship with the independent school districts, we feel comfortable that we can recommend and encourage, but they need to look at that themselves and determine if they feel that by doing that, we lessen the mobility. There is a lot of mobility when it comes to sports and spectators and so forth. So we have a great relationship with the superintendents of each one of the independent school districts. So we're highly recommending that and encourage that they look at that for at least 2 weeks so to make sure, because if things get worse, we don't want the possibility of not allowing sports because our numbers get to such a point that we have to take the next step. So really encouraging it, but you're absolutely right, Andy. It is the, they still have to go through the schools, districts, and they make their own decisions on that.
Okay, Judge, that is all that we have so far.
Well, I wish everybody a good evening. And like I said, it's going to be critical for our community to stand firm. It's always better to do the most we can immediately and then avoid long-term critical situations on public health and also on our economy. So it'll be up to us. Do we want a short-term, one more time, really cut back and then get back on track? Or do we deal with this situation for the long haul? And that's something that I do not want. On the economy, we have some incredible business that are holding back, and they've done a tremendous job. And we have public health, and we're very supportive. I'm hoping that the community sees the balance between public health and the economy and realizes how difficult a decision that is, not only from myself, but from our health officials, from Chief Rodriguez, from the things that our CEOs from our hospitals have to do. And what Dr. Carranza has to manage during these times. So it's not favorable to be on the headlines for these kinds of statistics. And so I know we're going to do the best that we can. So once again, to the community, we wish you the best. We'll do everything that we can to support every one of our decisions. Thank you and good evening.